I would like to show you our database and register for facial anomalies. If you want to understand why we have designed this register, we have to go to our web page of the parent association ALA. ala-bg.org, and there is a English version, so you have to go there. There is a lot of programs for funding the treatment of facial anomalies in Bulgaria, thanks to the activity of ALA, and there is a link here to the register. This register was I can use Google Translator for that. So this was a register funded by the Ministry of Education and in partnership with the Plovdiv University, but the main work has been done by the team of the Plastic and Craniofacial Surgery Unit in Plovdiv and ALA, the Parent Association. So we began to enter patients in September 2013, and the project finished in 2014, and until now the funding is completely done by ALA. So we are still working on functionalities in statistics, and this video is showing the general possibility of this database. So if you go to maps, you can see where some specialists are already registered in the country. So a new parent can find the specialist for feeding, for example, in different cities where they have the needs. If you go to specialist, you can see that there are already 50 specialists with their pictures, and we have surgeons, speech therapists, feeding specialists, ENT specialists, and orthodontists. Here in specialties, you can see that for each specialist there are different information that can be marked in the menu. So, for example, for the speech therapist, we are using the Eurocleft scale. The same for orthodontist. The Gosling yardstick is also present here. So all the record of the patients are inspired of these needs for evaluation for international comparisons. If you want to see videos, it's important to download this program here that permits the video files that are for the web. So if you want to go inside the register, you need access, and I will use my username and password to go to the patient that have selected me. So each patient, when they are registering in the network, they have to sign a statement that they approve the confidentiality, and they have to do it choosing the main team in Plovdiv. Then they can use the rest of the specialists near their home. So all these patients, that are 449 until now, are selecting me as a surgeon, and I can go to check all the patients that I have. For example, each patient has a picture here that has been the picture that I have used for the diagnosis, but they can change it for their needs. And when you go inside the menu, uh, we have to write in Cyrillic for the moment. So I will show you with one patient what are the possibilities. For example, this patient here has a cleft lip and palate unilateral and also a phasic hemangioma of the nose. You can see here the posts that are here. There are 2 pages of posts. We begin in the first surgery, what was the lip surgery, here in 2011. He was 2 months old, and we have done the lip repair. Then here 10 months the palate, then we have consultation, and then we can go to a new post. For example, if we see the patient now. So if I write new post, it could be a comment, consultation or therapy. I would do a comment, for example. So put the date of today, and I can write something, and then I can put some pictures or comments or video. For example, when I see the post here, you can see that there are different. Let me change it in Google Translator in English. Yes. So we have an orthodontist that has put a consultation. You can see it. And we have a speech therapist also here. But we have also a patient file, as the patient is able to put some pictures or to, yeah, these are pictures that the patient has sent it to us. And we have also, for example, our speech therapist has uploaded the video. I can show you the video here. Okay, you see that all these files are able to be downloaded also. If you go to files, all these files are chronologically marked, and you can see the different ages when they have been necessary to have consultation. And if you go to gallery, you can see all the pictures of the patient from the beginning until now. Okay, if you go to statistics outside of the confidential area, you can see that there is a link with the dynamic statistic. So you go to each year. In 2013, when we have begun this register, we have 58 cases that are already registered from a number of 86 that are supposed to be born in Bulgaria. If the frequency is 1 to 700 cleft lip and palate patients, like in other parts of Europe, we should have 86 cases, and we have already registered 58 for this year. Probably part of these new cases that we arrived are older, as for example the speech could be found after 3 years or 4. So part of these cases will come in the new years. So after 5 or 7 years, we can have much more precise data for the number of cases for each year. So we have tried to register all the cases that are coming for consultation, and we hope that in several years we can have a more precise idea. We can also have an idea mm, about the regional specificity of cases if you go by regions. So even for a specific region, we can have an idea of if there is some special region that are more affected